Di sebelah sisi kiri saya bersama dengan Puan Nur Adlina binti Haji Azman, merupakan pegawai pentadbir tingkat 1 Jabatan Penerangan Jabatan Perdana Menteri, juga selaku pengurus projek The Ovatruth PCOS, ya. Ya, Assalamualaikum Puan.
Waalaikumsalam.
Apa khabar pada pagi ini?
Alhamdulillah,
Sihat,
baik-baik
ya?
saja.
Alhamdulillah. Jadi bersama dengan kita, bersama dengan Puan Nur Adlina sebentar tadi, dan juga di sebelah kiri Puan Nur Adlina, ya. We are pleased to have with us this morning our guest Dr. Lydia Suguna Citra Karat, merupakan Ketua Jabatan dan Konsultan Obstetrik dan Ginekologi Pusat Perubatan Jerudongpak GPMC. Good morning.
Good
How
morning.
are you today, Doctor?
Thank you, very well.
Great, glad to hear that, Doctor. Thank you, Doctor, for being here in the studio with us to share your insights on today's topic about Projek Khidmat Masyarakat, the Ovatruth PCOS, ya. But first we will start with Puan Adlina. Kita akan mulakan bersama dengan Puan Adlina. Mungkin Puan Adlina boleh menjelaskan dan juga menerangkan sedikit sebanyak mengenai dengan kumpulan Ovatruth ini. Silakan, Puan.
Okay. Bismillahirrahmanirrahim. Terlebih dahulu kami ingin merakamkan setinggi-tinggi penghargaan kepada pihak Rampai Pagi kerana sudi menjemput kami sebagai tetamu pada pagi ini. Saya Nur Adlina, mewakili kumpulan Ovatruth. Kumpulan kami terdiri daripada 5 orang peserta yang eksekutif program YEP kohort ke-10 yang dikendalikan oleh Institut Perkhidmatan Awam. Ovatruth ditubuhkan dengan misi untuk meningkatkan kesedaran awam, kesedaran masyarakat tentang Polycystic Ovarian Syndrome atau lebih dikenali dengan PCOS ataupun PCOS. Alhamdulillah, sejak Jun lalu, kami menjalankan kempen yang bertajuk The Ovatruth PCOS dengan kerjasama dan sokongan daripada berbagai syarikat-syarikat tempatan termasuk Pusat Perubatan Jerudongpak.
Ya, baik, itu penerangan mengenai dengan kumpulan Ovatruth ini, ya. Jadi keramaian ahli pasukan ini berapa orang, Puan?
Seramai 5 orang.
5 orang.
Ya, 5 orang peserta.
Bersama kita hanya 2 daripada 5 orang ahli kumpulan ini tadi, ya.
Saya sendiri satu.
Okay. Boleh perkenalkan ahli kumpulan yang lain?
Okey, boleh. So dengan saya adalah Nur Faiza daripada pihak AGC, Muhammad Hazim daripada pihak Kementerian Pertahanan, dan juga Muhammad Aiman daripada KKBS Jabatan Belia dan Sukan, dan terakhir sekali adalah Muhammad Arifai daripada MOFI, Kementerian Kewangan dan Ekonomi.
Ada bersama kita hari ini?
Ada bersama kita di sini, di studio ini.
Ya, betul.
Antara ahli-ahli Ovatruth ini nanti, ya.
Ya, Alhamdulillah. Jadi nanti kita akan dapatkan juga apakah pengisian aktiviti-aktiviti bersama dengan Puan Adlina. Namun kita beralih kepada Dr. Lydia terlebih dahulu. Alright, now we turn to Dr. Lydia. As an obstetrician and gynecologist, we would like to know what exactly PCOS means, because we are sure some of the viewers may be curious about the meaning of PCOS. Also, why is it important for the people of Brunei to understand about it, Doctor?
Okay. PCOS, when you say, it is polycystic ovarian syndrome. It is a complex endocrinological condition. When you say endocrinology, it is involved with hormonal imbalance. Okay. It mainly presents with women who are in the reproductive age group. That is from the time they attained menarche until menopause, and they commonly present with irregular menstruation to us, and they have difficulty in conceiving, and examination will reveal small cysts in the ovary. When we say cysts, it's kind of sacs which are filled with little fluid. So that makes the ovary look quite big. So, and it is associated with metabolic syndrome. So that is what makes it more important, and it's important for Bruneians to know about it and take treatment for it, is because of the long-term problems that they can have if they do have polycystic ovarian syndrome, and if treated early, long-term benefits are there for it.
Yeah, so that is why it is important for us to understand PCOS, ya, doktor. Jadi seperti yang dinyatakan tadi, ya, memang penting untuk kita ni sama-sama memahami kerana ia bukan sahaja berkenaan dengan isu kesuburan, tetapi ini melibatkan juga kesihatan keseluruhan wanita yang mungkin boleh memberi kesan seperti yang dinyatakan oleh doktor sebentar
hormon
tadi.
Yang tidak seimbang
betul,
tadi, ya, seperti yang kita dengarkan.
Jadi kalau kita ni tidak memahami keadaan tersebut, ini akan lebih berisiko kerana tidak dapat mendapatkan rawatan awal. Jadi alright, we are still with Dr. Lydia. Earlier Dr. shared and explained the meaning of PCOS and the importance of understanding it. Now we would like to know more about why is it important for the public, including men, to be informed about PCOS, doctor.
The public need to know about it mainly because of the complication. Usually what happens is the women will come to us only when they have difficulty in conceiving, which is quite late. I mean, after marriage, they will try for 2-3 years, then only they come to us. Whereas this problem could be there quite early in their life itself, from the time they have started having their menstruation, very irregular menses. Some of them have menses maybe once in 3 months, once in 6 months. Some of them don't get menses at all.
Yeah.
So when you have a problem like that, it's important that you come and see the doctor and find out whether the particular problem exists or not. Because if it is left untreated and it progresses, you develop later complications. And some of these women go into depression because of their looks, because many of them are obese, so they don't like to socialize, they like to stay at home, they have other problems because of the looks that they have. So they lose their self-esteem, they are depressed, anxious. So before all these problems set in, it is important that any woman who has irregular menstruation should come and see the doctor.
Yeah.
Because the healthcare provider is the one who can make the diagnosis for them.
How does it affect men?
It affects us, one thing is of course infertility or subfertility we say, because the patients can conceive, but they will need some assistance to conceive. But more than that, it is the associated factors of metabolic syndrome, which includes obesity, high blood pressure, diabetes, having cholesterol problem. Cholesterol is the fat content in the blood. You have the unhealthy cholesterol and the healthy cholesterol. We find that in these patients, the unhealthy ones are higher and the healthy cholesterols are lower. So because of these complications and complications related to this metabolic syndrome, is the reason why we say come early and have a diagnosis and treatment done.
Yeah, so it's genetics one of the main factors contributing to the development of PCOS. Could you tell more about that, doctor?
Development of PCOS, actually it is, most of it is unknown as to why patients do get PCOS, but it does run in the family. When the mother has PCOS, there is a high probability the daughter will also develop PCOS. And generally women who are on the higher BMI side, that is obese patients who has a BMI of 30 is another patient who should have checked for PCOS. But it doesn't mean that only patients who are obese will develop polycystic ovarian syndrome. There are patients who are thin who can still develop polycystic ovarian syndrome. Diabetes, if there is a family history of diabetes in the family, that's another reason why we need to check for PCOS. The other things that we also look for is the presentation, how they present to us. They come with irregular menstruation or not having menses at all, and then they, when we examine them, they have excess hair growth on their face, like small moustache or beard, and there can be acne. Acne is pimples, lot of pimples on their face, so they feel all this kind of inhibits them to socialize much. And the other thing they can also have is darkening of skin. There will be skin patches, especially around their neck, underarm, below the breast. They can have darkening of the skin. So all these things, and the hair, they have a what we call as a female pattern alopecia, where there is a hair fall. So the hair becomes very thin and very sparse. So these are the things that we look for when we say, okay, this patient might be having polycystic ovarian syndrome.
Yeah.
So that's how you diagnose
Yes.
PCOS.
Yes.
Yeah.
It's not only that, these are the clinical features that they present with, but we need to do some blood tests for them.
Yeah.
Because there are hormones in the body which are male hormones and female hormones.
Okay.
So we are basically looking at the balance between the male and the female hormones. So in these patients we find there is androgen excess. When you say androgen excess, it is the male hormone which is excess. Okay. So when the male hormones are in excess is where the problem comes in. So along with this, they have what we call as insulin resistance. Insulin is what is needed in our body to burn up carbohydrates. Carbohydrates is the energy producing this thing that we need in our body.
Yeah.
So what happens is this insulin is there, but it is unable to act in the body. So that is what we call as insulin resistance. So we look for all this by doing blood tests for them. Not only that, we also do ultrasound. When we do the ultrasound, we are able to find the ovary. Ovary is basically the place where the eggs are produced from.
Yeah.
We find that these ovaries are enlarged or they are looking big with these small cysts. It's almost like pearls that are put around the ovary. They look small round cysts will be seen. So that's how we make a diagnosis of polycystic ovarian syndrome.
That is why important for men also know about PCOS and understand about PCOS. So this enables them to support supportive environment, to maybe their family members or maybe their partners. So all right, before we move on to Puan Adlina, we would like to ask another question for Dr. Lydia. When it comes to PCOS, what treatment that are currently available in Brunei, doctor?
Okay, Brunei, when we say, I'm from Derudong Park Medical Center, so we do have the treatment necessary. When it is an early stage, we do what we call as a conservative management. So we tell them the basis of it is lose weight and do exercise. By losing, I mean to lose weight you do exercise. And when we say exercise, it should be a high intensity one. So best is to join a gym, have a trainer who will teach you how to do this high intensity exercises. Because this high intensity exercises helps in sensitizing the insulin in the body. Okay, that is one. The second thing is we ask them to follow low carbohydrate, high protein diet. Okay, when we say low carbohydrate, all the things like rice, breads, noodles, all that you lower it. You don't stop eating carbohydrates because carbohydrate is needed in the body. So you reduce that, but you take more of proteins, vegetables, salads and things like that. So that's the diet part of it that you take. If it is a little more, then the little more severe form, then we can use medications to cause insulin sensitivity by using metformin. We have some medication. Probably you'll need to see your healthcare provider who could tell you what are the medications that you can use to treat this.
Okay. I understand.
Jadi itu antara beberapa simptom PCOS yang biasa seperti yang pernah kongsikan
Betul
tadi.
sekali ya. Jadi treatment ataupun rawatan yang boleh diberikan pada ketika ini adalah dengan menyarankan kepada para pesakit untuk melakukan high intensity training bersukan itu dengan cara pergi ke gym, mendapatkan para pelatih untuk memberikan mereka pengajaran dan juga latihan-latihan senaman yang berintensiti tinggi ya. Selain daripada itu juga menjaga permakanan yang mana penyaranan daripada doktor sebentar tadi adalah dengan mengurangkan pengambilan karbohidrat dan melebihkan pengambilan protein ya maupun sayur-sayuran. Ini adalah diet yang disarankanlah bagi para penghidap PCOS ini tadi dan terakhir sekali tadi jika perlu ubat-ubatan tetapi ini bergantung lagilah kepada doktor dan juga pakar apa saranan yang akan diberikan oleh mereka dan ubat-ubatan jenis apa yang akan diberikan ini tadi sekali. Ya. Jadi ribuan terima kasih doktor, thank you.
Thank you doktor.
Baik, kita beralih kepada Puan Adlina. Ya, baik. Puan Adlina, berbalik semula kepada tajuk kita pagi ini, apa sebenarnya objektif utama kumpulan Overachievers ini dalam menjalankan kempen kesedaran PCOS ini?
Pada bulan lalu, which
bulan
is
Julai,
bulan Julai 2025, kumpulan kami Overachievers telah menjalankan satu kajian awal untuk mengukur tahap kesedaran PCOS di kalangan masyarakat kita ni. Hasilnya kami mendapati masih ramai yang kurang mengetahui tentang kewujudan sindrom ini. So, kekurangan pengetahuan ini menyebabkan ramai wanita yang tidak mendapatkan rawatan awal walaupun mereka telah mengalami simptom selama beberapa tahun sudah. Jadinya oleh itu objektif utama kumpulan kami adalah untuk meningkatkan kesedaran awam, menggalakkan diagnosis awal, memperkasa wanita melalui pendidikan dan memastikan akses kepada penjagaan kesihatan yang mudah. Dan maklumat akhirnya mengurangkan komplikasi jangka panjang serta menyokong warga Brunei yang lebih sihat selaras dengan wawasan Brunei 2035 kita ni.
Jadi ada kajian lah sebelum ini berkenaan dengan PCOS ini dan ramai yang kurang sedar ataupun tidak sedar mengenai dengan perkara ini dan alhamdulillah mudah-mudahan dengan adanya projek sebegini akan menimbulkan kesedaran di kalangan orang-orang kita ini akan betapa pentingnya untuk mengetahui berkenaan dengan PCOS ini. Jadi projek ini sudah pun bermula semenjak
Jun lalu.
Jun
lalu tahun ini dan sudah pun berlangsung saya kira sekarang memasuki bulan yang ketiga. Baik. Jadi 3 bulan berprojek Overachievers ini, apa aktiviti-aktiviti yang telah dirancang bagi menyokong kempen kesedaran ini, Puan?
Dengan sokongan daripada berbagai syarikat-syarikat tempatan kita ni, kami telah mengadakan beberapa aktiviti sebelum ini. Di antaranya adalah bengkel pendidikan yang dilakukan pada Rabu lalu, iaitu di Institut Brunei Technical Education IBTE pada sebelah pagi dan juga di Politeknik Brunei pada sebelah petang. Di kedua-kedua bengkel pendidikan ini ia telah diberikan sambutan ramai dengan ada melebihi 150 penuntut dan termasuklah pensyarah yang menghadiri bengkel-bengkel tersebut. Selain daripada itu, kami juga membuka booth di acara program Bandar Kuchria pada kemarin hari yang menarik lebih daripada 200 pengunjung. Selain itu, kami juga sedang merancang sebuah forum terbuka untuk membincangkan PCOS secara mendalam bersama pakar-pakar, termasuklah pakar daripada Pusat Perubatan Jerudong Park. Dan forum ini adalah terbuka kepada orang awam dan pada siapa yang berminat. Maklumat lanjut akan boleh dikongsikan dan boleh diperolehi di Instagram kami, akaun @theovatruth.pcos. Dan untuk makluman bersama juga, semua kumpulan kami, ahli kumpulan Overachievers juga akan menyertai pertandingan larian yang akan diadakan pada 17 Ogos ini di Stadium Negara. Dan kami masuk di dalam kategori 21 km half marathon dan 3 km. Dan larian ini adalah sebagai simbol sokongan terhadap advokasi kesedaran PCOS.
Alhamdulillah.
Baik. Ini kita paparkan tadi Instagram mereka theovatruth.pcos.
Alhamdulillah.
Kedepannya ada lagi aktiviti-aktiviti lain yang dirancang, Puan?
Salah satunya yang seperti yang saya sudah maklumkan tadi adalah larian advokasi dan keduanya adalah Women Health Forum, forum terbuka. Dan ini akan dikongsikan nantilah
melalui dari GPMC
pakar
daripada
GPMC.
Jadi menarik sekali sebetulnya aktiviti-aktiviti yang telah pun disediakan ini. Sekurang-kurangnya dengan adanya bengkel tadi, ini kita ni dapat menyebarkan maklumat yang lebih tepat dan juga mengelakkan daripada salah faham dan juga menggalakkan sokongan perubatan awal dalam kalangan belia wanita. Jadi ingin kita ketahui juga bagaimana sebetulnya kalau sekiranya orang-orang ramai yang mungkin ingin mengambil bahagian ataupun menyokong kempen kumpulan Overachievers ini, Puan.
Terima kasih. Orang ramai bolehlah menyokong dengan menghadiri forum terbuka yang telah saya nyatakan terlebih awal tadi dan menyebarkan maklumat sahih tentang PCOS kepada keluarga dan rakan-rakan. Dan orang ramai juga boleh mengikuti Instagram kami di theovatruth.pcos untuk mendapatkan fakta-fakta mengenai PCOS ini. Dan paling penting, marilah kita sebagai masyarakat menyokong wanita yang menghidap PCOS ini agar mereka tidak merasa sendirian dan terus diberi semangat untuk menjaga kesihatan diri.
Ya, alhamdulillah ya. Jadi sebelum kita beralih untuk di akhir segmen wawancara ini, we would like to move to Dr. Lydia, and finally to conclude our topic today, perhaps you would like to share some advice or any thoughts, doctor? Maybe any advice for our viewers.
Okay. Thing is, we have to think of the long-term complications of PCOS. Okay, when we say long-term complications, almost 60% of these patients who have PCOS develop diabetes later in pregnancy. So lifestyle management to prevent this is important. The next thing is hypertension. There is a 3-fold time increase. That means when you take a general population and the population with PCOS, almost 3 times more chance of them having high blood pressure in pregnancy. The next thing is cardiovascular problems. Because of the high cholesterol content in the body, they do have another 3 times higher chance of developing any cardiovascular problems like heart attacks and things like that. The other long-term complication is endometrial cancer. Because of the fact that they do not have menses for long duration of time, there is a particular female hormone, estrogen, which is unopposed. So what happens is that goes on acting on the lining, and that makes them develop endometrial cancer or precancerous lesions. So that is the reason it is important that we catch this when they are young, introduce the lifestyle management to them, treat it while we can, and make sure that they do not develop this long-term complications. So for this, JPMC is going to launch a package in September 1st. We are launching this program in JPMC itself along with them. So we will be offering those blood tests and investigations and things like that. So the public can reach out to us. We will be more than happy to help them.
Okay, yeah, and we would like to thank you for being with us in the studio, Doctor, and sharing important information about PCOS. And we hope to have you with us again in the near future, Doctor. Thank you once again and have a great day. Dan terima kasih kepada Puan Adlina juga ya kerana berkesudian berkongsian berkenaan dengan aktiviti yang akan bakal mengambil tempat insya-Allah nanti ya.
Betul sekali ya. Jadi mudah-mudahan akan menimbulkan banyak kesedaran lah di kalangan orang-orang kita ni. Kan betapa pentingnya untuk kita ni mengetahui berkenaan dengan PCOS ini tadi. Terima kasih sekali lagi dan assalamualaikum.
Thank you,
Doctor.